Hello, beautiful people. Welcome to your #1 talk show. It is Eye to Eye with your one and only Sabi Girl. Yes, as it is today, I'm going to give you, in fact, man, don't even do like say I want to wrap the thing for English, because the disease or the virus where they go on right now, no Sabi speak English. In fact, the China where the thing from comes, na ching kon chong, in convention, ting collection, now they speak. So as it is right now, we have to drop the thing, make we break them down as it be or as it be already. Alright, this is Eye to Eye, and I'm going to be talking deep into these viruses, disease, germs, and everything we don't they do like say they want to spoil our country. Maybe so we be. As it is right now, even United States, all the other states, they don't try to see how they fit quarantine people, put people for one place, lock people up for this side, and make we not go out like play. Make say Nigerians there everywhere. They fool everywhere for this our country, or everywhere where they abroad. Make you know, we say they go where they go carry waiting, they will carry come back. The thing can begin affect us here. First of all, we start with swine flu. We can't enter bird flu. Can't enter Ebola. Can't enter SARS. Can't enter plenty ones where they enter. But I go just leave them for people when they into the medical field to touch light them. So today on Eye to Eye, I know they here alone. I sit down with person when they don't go school. He not just go school. He pay him money to sabi human body, sabi public health, sabi everything we get to do with health and your own health. As I sit down here, I don't sit down here alone. I sit down with Obong man. Now what you be like yourself just a chief doctor. Or make a leave and make you use your hand, do your own intro yourself. But I sit down with Dr Laz Ude. I think they for join the Udeze. Come on, leave for the Udeze. Welcome to the show. This is Eye to Eye.
Thank you very much.
All right, can we meet you? Can we know who you are?
Yes, like you said, I've been studying medicine for University of Ibadan. I did my postgraduate studies in public health policy and management at the University of Kentucky in the US. And I also did global health. I'm certified in public health, and I have about 12 years experience, working in the health developments from clinicals to communities to different areas, including malaria, HIV, TB, family planning, cancer, immunization, and others.
So how has it been for the past 12 years? How's the experience been?
Well, it's been good. We've experienced different things, the good, the bad, the ugly, and my job is just I dey try make I contribute my own quota to make body matter dey chim for Obodo Naija.
You get what they talk say everybody get their own prayer according to a field of work. That's when they sell food, they pray make people come chop. That's the way they where they come. What is the doctor? Because we need person when they medical health to actually put this thing right. What is the doctors their prayer points? Make people
prayer points that make people well.
Yeah, it's
smart prayer points that make people well. Okay. And then everything they work make people well. Okay.
All right. So now, as we pray now, make people well. All of us they see how the thing don't be. We want everybody to be all right. We want the economy, the system, even the economy too. We want the health, public sector, everything to be all right.
Yes.
But as it is right now, we deal. LassaFever will feel say don't go, don't come back. And with the cases now being on ground, we don't know the next step, or we don't know the next. The common man when they out there, no even understand waiting this thing be. They don't even know the precautionary measures to take. If you help me throw light on this, make that man that market woman when they there understand the little things where she fit even do to avoid this LassaFever where they go on right now.
Okay, thank you very much. LassaFever, na virus they cause them. Virus now small tiny organisms. If you use koro eyes here, you got enter microscope, look and touch light well before you go see. So and the interesting thing we say that Lassa now name of a town in Nigeria. Yes, 1969 at the first time, just as this coronavirus they talk about now, I say Wuhan coronavirus. Wuhan is the name of a place for China. Okay. So that's so they can't find this virus in 1969, the first time. Lassa village in Borno State. Okay, so that's where the name comes from, LassaFever. So it's like now Nigeria get this virus. Now Nigeria be the headquarters of LassaFever. And like plenty other viruses, if in enter body, they this is where they carry up rats. Okay.
But what concern human being and what be our dealings with rats?
Well,
make the thing go just
get things
like
they
that.
call zoonotic diseases. Zoonotic diseases now, disease where person feel carry from human being feel carry from animals.
But we know the two get one-on-one connection.
Because rats they environments, we they share the same environment.
Okay.
So if from rats they enter our environment, if we enter our food or things where we they touch, okay, and from there we touch some things, our hands can't touch where the LassaFever virus they.
Okay.
You understand? From there you buy granules, they chop. Or we put your garri for inside room, for inside nights, you know, throw away your dirty. They can't invite cockroach, rats, so many other things. They can't do conference to chopping conference for inside your kitchen or inside your room where you know throw away your dirty. So from there, you know, they go come run over your plate where you don't wash, pack, as in they work out the, you know, the torchlights, other things where they inside kitchen. So if you keep garri or other things, even beans, they feel run over them. So if the virus you know, they garri for instance, and maybe you call soap garri,
You don't enter.
you know, it go enter your body. Or you run over plates, you carry the plate, don't wash and keep, and you know rinse the plate, and the virus there, you can't put food, chop. It go enter. Or you run over the surface of your kitchen or other places, you can't touch around, do all this thing. Next thing, you carry granules, pour for hand, chop.
But let me ask you, we don't believe, like, over time, not be today where rats begin live with human beings in the house.
Yeah.
Not be today where all these things have been there in the past. Why are they manifesting now?
Okay, get plenty reasons to run. One be say, na improvement for our health system. Because one be say, if disease dey and you don't know the name, you don't know what it be. Now people go say, they go this hospital, they check, they say they don't see anything. They go the other place, they check, they don't see anything. Next thing, they'll come, they blame my. If it be that my neighbor I quarrel with the other day, if it be, they go begin blame our village people. Village people don't suffer for this country, you know. So begin they say, if it be this, they don't know. The next thing they go prayer house, go begin do prayer. You know, if na LassaFever for instance, and you don't know what it be, just they do all those waka, they take paracetamol, they take different drugs, you know, and maybe from there you can't go the extreme symptom and all that way blood go, just they come out from everywhere. Next thing is, na poison, or person don't poison her, and the person go die. The thing will say it dey, but if you know torchlights and know what it be, do the test, we tell you say, oh, this thing na LassaFever. It's not malaria, it's not typhoid, it's not cough and catarrh, it's not any other thing where fit present with hotness of body, or you know. So if they know quarantine the person, do that test, call am name. It will be like say no be am.
All right. So make we look the symptoms of Lassa, because as you talk, so a lot of people get them. They still feel so in our village people they do them. A lot of people still get them. They day for church. No, not be joke. No, that not be lie.
Not true.
So make we look the symptoms now, because some people they don't know what it even be. Talk more the symptoms. They feel just say now. They say, my papa, any small thing when do you? Na malaria.
Yeah.
Even for your friend that this LassaFever do, you go say na malaria, and na malaria you go dey treat. Meanwhile na Lassa. So what be the symptoms when we come with this Lassa? Then we go enter corona when we finish.
Yeah, and then I would think plenty people they do the symptoms now, just the regular symptoms where malaria fit give you, where other infectious diseases fit give person. If you enter body, enter inside blood, you know, the first major symptom na fever, hotness of body. The normal body temperature na 36.6 to 37.5 degrees Celsius. Okay, so if you pass that 38 and all that, well, it's a sign. You know me say if your body dey hot, you get LassaFever. Wetin e mean, especially now where outbreak dey, there should be what we call high index of suspicion. High index of suspicion be say, okay, person they get hotness of body, you know, e dey very weak. Muscles they pain them, you know, if even they vomit, they get all those symptoms. You've done malaria test, it's negative. You've checked other common things which you give those symptoms and they are negative. You suspect could it be Lassa. So if you get that suspicion, you alert because you get what they call surveillance. Surveillance now shine your eyes kind of thing.
Okay.
They do for health sector. And that kind of thing now within Nigeria Center for Disease Control, they do now with the various state ministries of health and all that. So if you just suspect, you notify them. You go tell the person abeg if you dey this side. Minimize contacts and all those stuff. So make they come torchlight, know whether, especially anywhere in the country, because now at least 19 states now where they don't find people where get this thing. If you dey one state, all the other states are at risk. They start from one state, you begin they move. You know, so nobody say you go say, I did this state, you never did my state. You know. Yeah. So those are the things. So if you rule out other common illnesses and you don't find evidence that is malaria, is typhoid, is other viral infections, then you suspect that it could be Lassa, and you notify the relevant authorities. They will come. There are labs in the country now. You know, they have one in Ebonyi State, Abakaliki, that you could do the test. They have one in Irua in Edo State. You know, even FCT here has one special lab. You know, that's been provided where all these things are done. It's not everywhere you have the bots. Now, government people, if they suspect, and then go collect the sample, and then go the lab, do everything free of charge, and make sure, say, if it's Lassa, the person is treated.
They fit treat them.
If you treat them, the thing that say, it gets some way, if it enter their body, it no go even cause very serious symptoms like that. Do you understand? But it go from them enter another person's body. Okay. You understand? Some fits and the treatment are mainly treating the, you know, the symptoms where they show. Body they hot, you give something for the fever, make the person comfortable as much as possible. You know, so you know, everybody will get up go just die, but you cannot know by face. Say if I get up, you know, go kill me. If this one gets up, it go kill him. So the best thing is to just avoid it, and the general hygiene. They take care of environment, stop bush burning, because if
bush burning, because I'm not talking about that bush burning.
Yes, because these things they get from environment. If you go the burn bush, if they pursue rats from their home. So when you pursue them from there, they go run out of that place, come into our own home. Okay. You understand? And that thing now make them say park for streets where you know clear them. You know, all these rodents and all of that, they will go find food for there. Okay. You know, so when they go find food for there, they run around our environment. So if maybe every rat they carry Lassa anyway gets the species of rats where they carry. So if not that species and they carry the virus, you go run around the environment and that thing pickings them if you go play for the same area where they pass, you know. They fit pick the virus from there, enter house, adults go carry picking, you know. All these things are things where they, you know, follow custom. So keeping the environment clean, washing hands regularly. The thing we say, if you enter my hand now, if I wash hand well with soap and water, it go come out. If you want chop things, heat them, cook them. If you do inside my beans and I cook my beans, you go kill them. Okay. Do you understand? So this virus, you know, they survive.
What of hot water when you take make garri?
Hot water go kill them. So the one with you, if you take garri and you soak the garri, pour cold water. So
that means you're not going to drink garri again now.
Well, we not say you know when you don't drink garri. If you put your garri inside house, cover them well, and also one thing way, because sometimes don't be even for inside your house. If you don't take the garri before you buy them, you understand. So our public health department, especially for inside local government, because when they talk about these things, people just they look federal government. Plenty of the solutions now for inside our communities, inside the local governments and all that. Then plenty of these solutions there. So we need to, everybody need to play their role, sensitize people. It's very shameful. I use that word. Yes, every year people they die of LassaFever for this country. When we know the cause, when we know how to prevent it, when we know everything.
But what think government they really do about them right now, apart from this lab the way you don't mention? Because okay, now person when they for Port Harcourt will get them. If they need to travel come Abuja come do the test or travel go maybe Ebonyi or something. So how will take make this thing spread around Nigeria? Because government they support them.
Yes, of course. Government, they do their part. The federal government in particular. I can't speak for them. Cannot be government officials, so them I go speak for themselves. But from waiting, Nigeria Center for Disease Control they do. Then they put out for their website and they put out for social media. They give warning, advisory. They tell people how to prevent them. Then they work with health workers for the affected states and hospitals. They follow up. They capture data. According to last data release, about 258 cases have been reported. About 41 don't die. 41 persons, too many. Nobody is supposed even they die from that thing for Nigeria because it don't too kill people. And even two medical doctors follow for those where they say don't die from this.
Let's briefly talk about corona. This corona now, come the years the government say don't lock down some Chinese eateries, supermarkets and all. Why they get to wait till this time before they do that kind of thing? And then this corona self, Alpha.
Okay, coronavirus, now virus where they report say for Wuhan town in China, I think 7th of January, when they come find out say okay, you get these plenty cases of pneumonia, chest disease and all that where they abnormal, so they come begin torchlight them, come see say okay, you get this special virus so where they never see before, where they cause this thing. So because coronavirus in itself it don't dey there. Now in they cause SARS, now it cause Middle East Respiratory Syndrome, MERS, and different other things. But it's like a family. Within a family, they get A, B, C, D, and all that. So this one special strain where they just find out now. So that's why all this, if not the regular one where we don't know before, maybe all this panic for not even there because some of them you already know what to do. But whenever you can't find new organism, new virus, where begin cause illness, they cause a lot of panic because you don't know how it will take behave, you don't know how the cause go. So plenty research and torchlightment they go on, to make sure say they nip them in the bud. So that's why the actions now, like I said earlier, I can't speak for government. I can only speak as a citizen and as a health professional. So the thing we say when it comes to body matter things for this Nigeria, we know they try. I go talk as
no leave them for them.
So no, we not go leave them for them because this thing, all of us are potential victims.
Yes.
Me say we know they do anything at all. But things where they do no reach waiting we suppose they do. You understand? We suppose consider health as as a security issue.
All right.
You understand? So health na security issue because we just talk 41 die from LassaFever. Just imagine say na one small plane carrying 41 person crash. All of them die. You see the kind of shock it go send for people body. So that's what this LassaFever had done just within this month alone. Okay,
Dr. Obong could just do am. We go talk, me and you, we go do am again. We go yarn more on top this Lassa matter and then corona fever. But for right now, we'll just be like say they give me signs, say time don't go. But I go like call you again. Mo sit down well, give ourselves straight time to talk more on this one. But ladies and gentlemen, this is your #1 show, Eye to Eye. Sorry that the much of you go be this, but Dr. Laz will come back here and we'll talk more on these issues. We don't be like say the life threatening to our society today. We will still deal with them and then we'll see how we fit. Even join hands with government, see how we totally eradicate this issue. Come up from we country. But I do this. We want to thank all of you who watch the show, and of course we will see you again next week with another better Obong episode. Yes, I will still bring Doctor back next week. You will come, Abi. Try come here, you can't choke mouth more for me. All right, come here, everybody who watch the show. We want to say thank you now. We will see you again next week. From me and them and everybody, we say goodbye.
Bye.